Sean Williams, and I'll be talking about anxiety disorders. Anxiety is the central nervous system physiological and emotional response to a vague sense of threat or danger. There are several different types of anxiety disorders. There's the generalized anxiety disorder, a disorder marked by persistent excessive feelings of anxiety and worry about numerous events and activities. And then you have phobias, which are two parts. A persistent phobia in general is a persistent and unreasonable fear of a particular object, activity, or situation. And then there's two types of phobias: a specific phobia and a social phobia. A specific phobia is a severe and persistent fear of a specific object or situation. A social phobia is a severe and persistent fear of social or performance situation in which embarrassment may occur. And then there's panic disorder. This is an anxiety disorder marked by recurrent and unpredictable panic attacks. And then you have obsessive compulsive disorder, a disorder in which a person has recurrent and unwanted thoughts and need to perform repetitive and rigid actions or both. The history with anxiety disorder is that anxiety disorders are the most common mental disorders in the United States. In any given year, 18% of the population suffers from one of the anxiety disorders. Close to 29% of all the people develop one at some point in their lives. People with generalized anxiety disorder experience excessive anxiety under most circumstances and worry about practically anything. The problem is sometimes described as free-floating anxiety. They difficulty have concentrating. They feel restless, keyed up, on edge, and they tire easily, and they suffer a lot from muscle tension and have sleep problems. The symptoms last at least 6 months. Although most people with generalized anxiety disorder seem to carry on as normal and have social relationships and job activities. Generalized anxiety disorder is most common in the Western society. They say that 4% of the United States have symptoms of the generalized anxiety disorder, compared to Canada, Britain, and the other Western countries. In any given point in time, 6% of all people develop generalized anxiety disorder at some point in their lives, and it can emerge at any age. And most commonly, women develop the disorder more than men do. As for a specific phobia, it is a persistent fear of a specific object or situation. When people are suffering with this disorder, they are exposed to a specific object or situation. They typically experience immediate fear. Common phobias are animal, insect, heights, enclosed spaces, thunderstorms, and blood. Social phobia it says that 7.1% of people in the United States experience social phobia at any given time. Around 12% develop this disorder at some point in their lives. It tends to be in late childhood or adolescence and may continue into adulthood. In panic disorders, basically what happens is that the attack features at least 4 of the following symptoms: palpitations of the heart, tingling in the hands and the feet, shortness of breath, sweating, hot and cold flashes, trembling, chest pains, choking sensations, faint dizziness, and feeling of unreality. 1/4 of all people have one or more panic attacks at some point in their lives. Some people have panic attacks repeatedly and unexpectedly and without apparent reason, and this is at the point where they really begin to suffer from a panic disorder. As it relates to OCD, it's an obsession or persistent thoughts, ideas, impulses, or images that evade a person's consciousness. Compulsions are repetitive and rigid behaviors or mental acts that people feel they must perform in order to prevent or reduce anxiety. This disorder is classified as an anxiety disorder because the obsession causes intense anxiety, while the compulsions are aimed at preventing or reducing anxiety. Anxiety rises if individuals try to resist their obsessions or compulsions. Between 1 or 2% of the people in the United States and other countries throughout the world suffer from OCD in any given year. It is equally common in men and women and among people of different races and ethnic groups. The disorder usually begins in young adulthood and generally goes on for years. Although its symptoms and their severity may fluctuate over time, it is estimated that more than 40% of people with OCD seek treatment. The DSM-4 has specific criteria that needs to be met in order to be classified as having one of these anxiety disorders. For the generalized anxiety disorder, a person must display excessive or ongoing anxiety and worry for at least 6 months about numerous events or activities, difficulty controlling the worry, at least 3 of the following symptoms: restlessness, easy fatigue, irritability, muscle tension, sleep disturbance, significant distress or impairment. As it relates to specific phobia, the DSM-4 says that it needs to be a person needs to be showing symptoms of marked and persistent fear of a specific object or situation that is excessive or unreasonable, lasting at least 6 months. Immediate anxiety, usually produced by exposure to the object. Recognition that the fear is excessive and unreasonable. Avoidance of the feared situation. And have significant distress or impairment. Social phobia should be marked by persistent and fear of social or performance situations involving exposure to unfamiliar people or possible scrutiny by others, lasting at least 6 months. Concern about humiliating or embarrassing oneself. Anxiety usually produced by exposure to the social situation. Recognition or embarrassment of oneself. Recognition that the fear is excessive or unreasonable. Avoidance of feared situations. Significant distress or impairment. The DSM marks panic disorder as recurrent unexpected panic attacks, a month or more of one of the following after at least one of the attacks, persistent concern about having additional attacks, worry about the implications or consequences of the attack, significant change in behavior related to the attacks. The DSM marks OCD as recurrent obsessions or compulsions, past or present recognition that the obsession or compulsion are excessive or unreasonable, and significant distress or impairment or disruption by symptoms for more than 1 day. This is the overview of anxiety disorders.